Hi, this is Dr. Monica Cisneros. Please watch this powerful interview and testimony of how the functional medicine approach allowed this patient to reverse her health conditions like rheumatoid arthritis, hepatitis, which is caused by a virus, leaky gut, allergies. Please watch. She is negative for RA because we were able to find the underlying causes. Stay tuned. When this patient showed up in my office in 2017, all I knew that she has so many problems. She had no lab testing and she had no answers. So I had to take this comprehensive investigation to get to the bottom of the problems. And indeed, I did find that she had been infected with a hepatitis virus, that she had rheumatoid arthritis, food allergies, severe nutritional deficiencies. What I knew for sure was that her immune system was not balanced and it was overreacting to the point of attacking her own joints. So we needed to get the immune system to work for us because obviously her immune system had not been efficient at fighting and preventing the hepatitis virus to infiltrate her liver. And it was too busy fighting her own joints. So we needed to identify the underlying causes of all this, the food allergies, seal the gut, and turn off all that inflammation. And most important, optimize her immune system. Let's watch. I'm going to use this picture to explain leaky gut. On the bottom, you have a blood vessel. On the top, you have cells, which are the barriers. Between the cells, you have openings where nutrition goes into the blood and is delivered to all the body and is stored inside cells. Those openings are held by special bonds. You can call it glue. But on the right side, those cells have been affected. Therefore, the openings are big and pathogens, viruses, foods enter the bloodstream and create an inflammatory response and can lead to autoimmune disease like rheumatoid arthritis. The way rheumatoid arthritis is treated is with medications to turn off the immune system. We were able to reverse this illness without medications. Instead, allowed the body to heal and give nutritional and lifestyle changes. The reason this patient was infected with the hepatitis virus was because pathogens, viruses, go into the bloodstream when our defenses, our barriers are broken. Please watch this powerful testimony of how functional medicine changed this patient's life. And I want to take this opportunity to educate patients of the importance of health exams and using the functional medicine approach to look into health. What symptoms brought the patient to my office? What was the medical problem?
So I started to have a face rash on only my right side of my face. And I tried everything, a dermatologist, I tried going to different doctors. They never figured out what it was. They thought it was just a skin condition, rosacea or dermatitis. Then I finally heard about Monica Cisneros, and she took care of me really good. She did a blood test and she found out that I had an autoimmune disease. So we had to take the necessary steps so she would use my immune system to fight, because she told me if I went to other specialists that they would put me on steroids and medications that would make me feel better, but in the long term it would affect my health a lot. So I started to do exactly how she told me to do, taking care of my diet, listening to stay away from all of my allergies. And after about a year and a half, I was able to get my immune system up and I was able to feel better and healthier. And yeah.
So I know that looking at your labs, we can see that in 2017 you had the rheumatoid arthritis factor positive, correct?
Correct.
What were your symptoms back then?
So back then I was very, very exhausted. Anything, a small task would make me feel very exhausted. My bones, my joints would hurt a lot, especially from my legs. I couldn't keep up for a young person. I mean, the inside of me was dying basically. So I remember throwing up at one point. I had my skin allergy. It would itch so bad. I felt like I had a face mask all day. My face was dry. I didn't have an appetite. My body was just trying to tell me that something was going on. So I was bad. I was tired.
And you also developed back then hepatitis, correct?
Correct, I did.
And it went unnoticed by your primary care doctors, correct?
Yes. Yeah.
So when I saw Jocelyn, her liver enzymes were up the roof, and her immune response was over exaggerated. She had anemia and she had all these deficiencies. But what were the doctors doing back then?
Nothing.
Nothing. Okay.
They did nothing. They didn't even take a blood test. They just would look at my face and say, "Oh, you have dermatitis," or they would think that I was anorexic because I didn't want to eat. But they didn't know that it was because I had the hepatitis. My body, it would just hurt. My stomach would hurt eating anything. So they just assumed from what I was telling them what I had. They never did a blood test. They never deepened any blood test at all.
Yeah, so that comes to show the importance, because hepatitis is still a virus. So obviously Jocelyn came this year because obviously she's concerned for COVID-19. She works in a bank where she has exposure to customers, and she wanted to optimize her. Our health depends on a strong immune system and on strong barriers. It doesn't matter if it's hepatitis virus, if it's influenza virus, if it is COVID-19, it doesn't matter. If your immune system is not strong enough, it cannot resist the fight. And when I saw Jocelyn back in 2017, she was very, very weak. I mean, she has changed to be somebody that was really ill, to be a normal functioning adult. Her skin has changed, her everything has changed. And I think the reason why I want to do this video is to help patients understand that the medical route is amazing, it's great, but we doctors have to do due diligence. We cannot just tell patients, this is like a skin disease and not look for underlying reasons. Yes, she had a skin condition, that is correct, but what was causing the skin condition was this overload of allergens, and the liver was malfunctioning, and she had her immune system was attacking her joints. That's the body part that her body decided to attack. And how are your joint pains now, and your aches and pains? How are they now?
A lot of the times during the winter, my joints would hurt so much to the point where I was even scared to walk sometimes without not feeling pain. But this winter and the last winter, I mean, my bones don't hurt at all. They don't hurt at all.
What changes have you noticed on your labs because you have done like a health exam every year with me? What are the changes that you can see in your lab results?
So definitely my protein went up a lot. My vitamins, I used to take about 20 vitamins a day, and now I only take 6. So I was able to boost up a lot of the vitamins that I needed. My allergies went down. I was able.
What were the improvements after treatment?
My vitamins, I used to take about 20 vitamins a day, and now I only take 6. So I was able to boost up a lot of the vitamins that I needed. My allergies went down. I was able to have a more clear face. I mean, everything. My hepatitis was gone.
Yeah. And the liver came back normal.
Yes.
And that's I mean, obviously the medical route is great. And I give credit to all the doctors that are out there in the healthcare front lines. But we just have to take this approach to just listen to our patients and keep looking. Because otherwise patients start losing hope on the system, and patients start getting lost in the cracks of our system. And I think that I just feel that this is something important for us to realize. So making lifestyle changes is not easy, but it pays off.
Everything has wheat, even chocolate has wheat. So it's been a little difficult. I remember going to the store and looking at all the food labels and spending hours trying to avoid everything that I couldn't eat. But it paid off. It really did.
Low cholesterol can lead to depression and anxiety. Underlying depression and anxiety, and it was because she had low cholesterol. In order for me to give a patient a roadmap, I need to have an overview of the immune response. Her immune response was down here, okay? Optimally, we would want the immune response to be here. This year, we have not done the micronutrient testing because she's under control, and right now she has deficiencies, so I want to fix that before I do this test again. Vitamin deficiencies also cause symptoms. As you can see, we had an issue with copper, serine, vitamin D, vitamin E, potassium. So her bones integrity was being compromised. Healing requires teamwork, but it works. Advices you have for people?
Yes, I would definitely recommend Monica because she takes really good care of her patients. Her consultations are not 10 minutes. She really wants to get to the bottom of how you're feeling. She'll ask you so many questions because she really does care about her patients and wants to make sure that everybody lives a happy and long lifestyle.
And also she has access to me 24/7.
I do, and I'm super grateful for that. I don't have to wait for someone to answer the phone and say, oh, she's out of the office. She always answers me, and she's always, able to answer my questions at 24/7.
And sometimes it can be a question of, hey, can I take this protein? Can I take this food? Is there a supplement, like a substitute? So we have to be there for our patients. If they trust us, we just have to be there for them. And I know that sometimes it can be in the middle of other patients, but I think the importance is to not neglect our patients and understand that they are part of our families. And to me, they are family. And I know that it's gonna be a long road with this COVID-19, but I think that if we take Jocelyn as an inspiration of how the immune system can be optimized, I think we all are going to relax in feeling that there's ways we can feel safer. And I'm pretty sure Jocelyn can go back to work and say, you know what, I'm doing my due diligence. I cannot prevent that the virus is out there, but I know that I'm doing what I can to feel safer. Correct, Jocelyn?
Correct.
Yeah. Any last words for patients?
Stay healthy.
Yeah, stay healthy, definitely. Thank you so much, Jocelyn.
Thank you.